What is going on, you beautiful people? It is Thursday. We're doing a surprise live. I'm going to go through some of the many questions that I have gotten in the YouTube comments and have not had a chance to reply to. So, yeah, we're going to kind of go through some of the questions and chat a little bit and see how it's all going. I haven't done one of these in a long while because we have been ridiculously busy. Couple of new things that are in the works right now. I'm very excited about, and we'll be talking about them soon. So stay tuned, and yeah, let's kind of dive in and see what we have going on. Let me just double check some things. Well, I need to go. All right. We got that all sorted. Sweet. Let us take a look as to what you got for questions for me. So Nancy S.A. Blurin, a little off topic, but have you dealt with anyone that had an issue with eating a bit more when feeling nauseous? I always feel that I'm feeling a bit sick, that I must need to eat something. On Ozempic for 4 years now, lost 80 pounds, but have stalled for the last year. So have you dealt with anyone that had an issue with eating a bit more when feeling nauseous? I mean, when you're feeling nauseous and stuff and not feeling well, yeah, going and turning to food can sometimes be something that makes you feel a little bit better. I know certainly for myself, generally most of the time, if I feel like I got a bit of an upset stomach, eating something will generally make me feel better, or maybe it's all in my head. It doesn't really matter too much. But certainly it would in some respects, and certainly something that, yeah, I wouldn't say is wrong by any means. If you're kind of thinking like it's negatively affecting, your ability to lose weight and that sort of thing, maybe we need to look at adjusting the dose of the Ozempic for you so that it's not causing as much nausea and that sort. But yeah, I mean, that's not having nausea on the medication and turning to food, particularly high calorie foods, not necessarily uncommon by any means. So yeah, I think hopefully that'll answer your question. Shukrimo, your language is discutting and silly. I couldn't finish your video. You need to learn how to communicate. I always do love some of these comments, like when they're trying to insult me and then tell me how to communicate, and then they can't spell or type properly. I don't know why people need to announce it. If you don't like the content, if you don't like the language, then move on. Nobody cares at the end of the day. Yeah, I always find people like this just so funny. So I guess snooze you lose, bud. Lots of great content here, and yeah, it's too bad that you're getting all in a huff. Thank you so much. I had a quickie pen before, so first time with the actual needles. Thanks for showing me how to do it. Awesome. Yeah, the how to inject with Mounjaro, so using the vial and the syringes and stuff like that. That should be changing in most places. I know here in Canada, we're supposed to be getting the quickie pen, so it's going to be a multi-dose pen for Mounjaro. When that's going to happen is anybody's guess at this point. The fact that we just have a steady supply of all the vials is a pretty big win all on its own. So that yeah, may change as we progress, and we'll ultimately have to see. That looks good there. Dr. Dan, there are comments on X that Ozempic is mRNA technology. Can you advise if true, and for Mounjaro as well? Cool. Well, I think the first issue is being on X. That was a platform that I needed to get off very quickly, just because it's It's just not a very toxic place if you were to look at it in that kind of term of it. mRNA technology. I know there's some of the stuff with regards to the COVID vaccine, but mRNA technology is not this big bad thing. And to first put your mind at ease, Ozempic, Mounjaro, the GLP-1s are not made via mRNA technology. They are made instead by DNA recombinant technology. So basically, we're developing a program and system so that this long peptide can essentially get manufactured and create a large number or a large concentration of the drug so that we can then put it into pens and people can inject it. That's how we make a lot of molecules and that sort of thing, is using some kind of bacteria or other processes so that the DNA system can essentially create it, replicate it, purify it, and then we get to put it into a drug and such. So yeah, doesn't use mRNA technology, uses DNA recombinant, but there's going to be some overlays in those technologies and that sort of thing, and even in the future of what drugs and such are going to look like with regards to what drugs can do and the effect that they can have and so on and so forth. So mRNA technology, DNA recombinant technology, yeah, we've been using these for years and years and years. They give us the world that we currently have, especially when it comes to medications and that sort. So definitely would not be concerned or worried about that in any form or fashion. But good question. I'll have to do a bit more of a detailed video, I think, on just breaking it down and what actually is mRNA technology and DNA recombinant and that sort of thing. So someone on my protein powder video, I like Aldi's Elevation Whey Protein. I use half to 1 scoop in my morning coffee pretty much every day. Awesome. That's a great way to get some more protein in. Although I'd love to cook up a nice omelet with colorful veggies every morning, I just don't feel up to it most days. And a protein coffee is a better option than just eating toast and cereal. Totally. Yeah, I mean, if you don't feel up to it, you're not much of a morning person, what have you, could be a million different things, but the fact that you're being proactive and trying to get more protein in the in with your breakfast is awesome. And yeah, it's going to be a better option than, yeah, cereal or toast or what have you. Breakfast is definitely a big area that I see a lot of people struggling with, in particular with the protein piece of it. But it definitely can make a big difference. And the earlier you can start in the day of getting your protein in, the easier it's going to be for you to get that protein in over the course of the day. So this was on one of my videos where I was talking about, should we treat obesity like an addiction? Someone said, yes and no. An obese person craves food in a similar way that a drug addict craves drugs. However, the obese person was born craving food. Right. Drug addict is hooked because of poor life choices. And the further removed from a drug addict is, abstaining becomes easier. The obese person will always crave food differently than a person with less of an appetite. Yeah, I mean, yes and no. And I would certainly agree with you in that respect, in that there's similar brain areas and avenues that are similar to the addiction pathways and that sort of thing. The problem with food is that, yeah, we can't abstain from it, and we can't point to any particular kind of food. Like, people will say, I'm addicted to sugar, but they're not actually in the pantry eating out of their bag of sugar that you would use to bake with or anything. So they're not actually addicted to sugar. They're addicted to highly processed, delicious foods and that sort of thing. And it's more that their brain just really likes those foods more than somebody else. And ultimately, there's, pathways in terms of when you consume it, you're more likely to want to consume more of it, and so on and so forth. And then when you take it away, you can start noticing that your cravings go away. It's very complex interplay that can and look like addiction in some respects of things, but it's yeah, not the same in terms of just the symptoms and all the things that kind of come with it. And that sort of it. And we can't really narrow it down to one thing. Compulsion or compulsive behavior is kind of more along the line that the current community is going in, but more research and data is ultimately needed to really fully understand it and how best to manage it. So great comment. So question, I heard you mention that the TDEE calculator before, but I must have missed the dedication of 25%. When I first did it, I thought that was extremely high number of calories. Now I need to go redo it. Yeah, I always tell people when they use my TDEE calculator, they're probably going to be shocked by the number of calories that they're required or should be eating in order to lose weight. And a lot of people, will tell me I eat very little and this, that, and the other thing. And yes, you could eat very little, but if you're eating a lot of highly processed foods, your calories are still going to be sky high. As well, are you talking about eating very little 1 or 2 days out of the week, and then the rest of the week you're making up for it by overeating and overconsuming? Maybe. We want to aim for about 80% consistency when it comes to dietary patterns and activity levels. And a lot of people, Monday through Thursday, maybe to Friday or part of it, they make it there. So really, they're only consistent 4 out of the 7 days. And in reality, you need closer to 6 out of the 7 days to be 80% consistent over the course of the week. So it's kind of looking at everything in the bigger, broader picture of it. And yeah, if you eat a higher amount of calories, but it's still putting you into a calorie deficit, well, you're going to be able to much better manage cravings, hunger, and overeating on the other end of it. So definitely need to look at increasing those calories, and you'll be happier for it, and weight loss should be more sustainable and successful, particularly if you're adding in the activity piece. So sweet. So yes, as a type 1 diabetic, I'm currently taking Mounjaro. I can tell you the effect are quite incredible. I've been in range 94% of the time and almost within range the remaining 6%. Effect is amazing. Weight loss is an added benefit. So yeah, usually the GLP-1 based medications aren't as effective for people with type 1 diabetes because they have no residual pancreatic function for insulin production at all, which is part of the mechanism that these drugs use for managing your blood sugars. But on the other side of it, they also go to your liver and tell your liver to stop overproducing sugar, kind of get it to calm down and realize that, nope, we can regulate blood sugars, the world is okay, and so on and so forth. So it has another mechanism in effect. It also is going to affect dietary patterns, what you're eating, and that sort of thing. So you might actually be consuming less calories, less carbs, so on and so forth. And so that all is going to combine to help you to manage your weight and manage your diabetes, even if it's type 1. And generally, the GLP-1s are pretty safe in that respect of it. I've had a couple of patients start on it. The chance of like diabetic ketoacidosis, pretty rare. It would be more that some other confounding factors there causing them issues, such as they go on one of these drugs and they're not able to consume enough calories and food, or they don't dose properly with their insulin, and so on. So awesome to hear you're having a good experience. Oh man, okay. So health at any cost. I thought I'd come hang out with you for a few. Sweet, thanks for coming. I appreciate it. Fufu 2013. So what is your question? Do you read online GLP-1 forums? So many complaints are about nausea. There's a 400-pound woman anxious about Mounjaro because she's worried about side effects. Should the scientists just quit? I'm not entirely sure what exactly you're kind of asking or making the comment about there, but yeah, I've kind of perused some of them and have been in them. And to be honest, it's sometimes a little painful to be there because it's a bit of the blind leading the blind in some respects, and just bad advice getting thrown around, and the moderators not really directing people properly, and people, emergency situations going to a group forum instead of going to a hospital or something. And that's also where you're going to get that perpetuation of these poor science, bad ideas, so on and so forth. And I mean, nausea, it's not a pleasant feeling by any means. It's kind of, again, finding the right dose and tweaking and modifying to find what's going to ultimately work for you. I've had very, very few patients that have needed to stop one of these medications for the reasons of nausea. It's usually not a significant enough concern that we're really too worried about it by any means. So it's something we need to monitor for, but with proper support and proper monitoring and dose adjustments, generally we can overcome the nausea component and aspect of things. So Seattle Bicycler, how can I alleviate the side effects of Mounjaro? What are the best and worst foods to eat while taking it? Thank you. I mean, the general principles or general guidelines is more not so much foods, but eating smaller, more frequent meals throughout the day, avoiding any kind of particular trigger foods that you know cause you to have heartburn or nausea and that sort of thing. Trying not to overeat, so really mindfully engaging with your food, taking things slow, putting your fork down between bites and that sort of thing. Those are all going to help you to tune in better with when you're hungry or not, and hopefully prevent you from having any issues from that aspect of it. High fat foods for some people, particularly like really greasy foods, so deep fried foods and that sort of thing, could definitely be problematic as well. So trying to limit and manage how much you have of that. But a lot of times it's, yeah, just smaller, more frequent meals, avoiding trigger foods, and not eating and then laying down right away, giving yourself at least an hour. So that's kind of some of it. And then some of it, you might just have some side effects that can't be tied to food or anything like that, and can't really do a whole lot about them other than ride them out as long as they're not too significant. That's cool there. So there's a new GLP-1 med in trial that cuts off GIP. How can weight loss occur by both activating GIP, tirzepatide, and shutting it off? Amgens, I think. I think I know which one you're talking about. So GIP's an odd little molecule or odd little hormone and mechanism of action. We don't know exactly all the ins and the outs at the present time. What we know is that GIP has different effects at different dosages and concentrations. So in one sense of it, GIP is going to, I think at the lower levels, can actually stimulate blood sugar production and that sort, and potentially be weight promoting, whereas at the higher doses, it can lower blood sugars and that sort. I think that's what it is, my brain. It's the end of the day. But yeah, it's interesting hormone and how this intersection of the two, and again, it shows the complexity of the body and the things that are kind of at work and at play. And so it certainly could be, yeah, it still could be an effective medication. And again, another video that I will have to make. GIP, GLP-1, and Amgen. I think that's them. Yeah. Okay. Other questions here. Let me put that one back. Mounjaro diet. Someone loves me. Love you too. Thanks for tuning in. Another question. So, hello, Dr. Dan. Thanks for your video. I'm on my 3rd week now of taking a half tablet of naltrexone in the morning and a quarter at night, which I think is about 37 milligrams total. I'm already on bupropion, so my morning dose is okay. And I think at night it's a 90 milligram tablet. Is it working? At the beginning more so than now. Perhaps I still have to wait. If my cravings were scored as at a 10, being the most, I'd say I'm at a 7.5. Do you think I should put my doses of naltrexone in one capsule, in a capsule to make them more time release? That's a good question. So if you're getting Contrave, which is made up of bupropion and naltrexone as separate ingredients for insurance purposes or whatever, if your insurance provider will cover it, I try to get people onto a compounded naltrexone sustained release formulation. So they basically just add something to it that allows it to last a bit longer and more closely match the kinetics of what we see with Contrave. Just because the naltrexone that's commercially available is kind of quicker on and off, if you will. So it might help in the short term, but then wear off by lunch and that sort of thing. So sometimes what I also do is I'll do like 3 times a day dosing, but that's a pain in the butt. So yeah, I mean, you certainly could. That might give you more coverage for a full 24-hour period. You also just might not get much more of a result, depending on how effective naltrexone and bupropion are for you. Yeah, there'd be a lot of factors to kind of think about and take a look at. Not everyone responds to the Contrave and bupropion and that sort of thing. So it's, yeah, kind of tough to say exactly, but certainly worth trying if your insurance will cover it. So most people and doctors don't know that metformin is listed as part of the standard of care for lipedema. That is very true. So lipedema is an interesting form of obesity. It's basically made up of toxic fat that can't be lost. Really, the only way to remove this fat is via surgery, essentially, and it can lead to lymphedema and cause all kinds of problems and issues. Yeah, I'm currently working with a lady who struggles with that. And yeah, it's very painful. It's a lot of extra weight, and it can be very debilitating in some respects of things. So yeah, metformin can be part of that standard of care. Absolutely. What do you think about stacking the GLP-1s if I continue to take small doses of sema and added Reta? That would be a horrible idea. Yeah, definitely do not stack them in any form or fashion. Yeah, no, just take one or the other, just because there's only so many receptors that you have in your body. So adding one on that already has a GLP-1 in it isn't going to do anything extra for you. It's just going to saturate your receptors. And if anything, it's going to probably throw off the kinetics and things are going to get all weird and you're just going to get a buttload of side effects. This is where all the big side effects that people have ultimately come from, is people doing strange things like this. But no, I wouldn't stack them. And if you're looking at Reta or Retatrutide is not available commercially, has not cleared all the trials and stuff like that yet. So that would mean people are getting it from some online manufacturer or something like that, which more and more reports are showing it's not actually what's in the various vials and stuff. So stay away from online peptides. Do not go that route. Get what's commercially available if you can. And yeah, that would be highly recommended on that side. So please do not stack them. Okay, so that looks good. How do I tolerate? Makes me sad. Someone asked, does whey protein help if you're on Mounjaro? I mean, it's going to help in the sense that you're going to get more protein in, which is super important. Is it going to do anything magical with Mounjaro? No. It just will allow you to get more protein, and having like a whey protein shake or something like that might make it easier to drink if you're having trouble eating foods and having a whole meal. So that would be more the aspect from that component of it versus it doing something magical or special, if you will. So so another DEXA scan, 7% of muscle. Sweet. So health at any cost. Dr. Dan, I had another DEXA scan 2 days ago and have only lost 7% of my muscle on my 265-pound weight loss. Very proud of myself and the work I've done. That is so, yeah, that is so amazing. Really, really cool. It's like the fact that you've retained so much, like fantastic. The more muscle mass that you can retain, the better, the healthier you're going to be, so on and so forth. So good on you. That is awesome. Solo H, thank you for everything you have done and do. My pleasure. I've been on Ozempic for 6 months and currently at 1 milligram have lost over 40 pounds. My binge eating is finally under control. That is so cool to hear. Congratulations there, Solo H. Like that is huge. That is a big accomplishment. And I'm very happy to hear that it's so effective for you and helping you to kind of manage binge eating and all the pieces around that. So yeah, amazing. I love hearing stories like that. Which weight loss drug in trials are you most looking forward to? That's a good question. I mean, I think Retatrutide, if it clears all the regulatory hurdles and stuff like that, that drug is going to probably be a big game changer just with the phase 2 trials and the results they're seeing there. I mean, Mounjaro is already like mopping the floor in some respects and all the things that they're getting indications for, but Retatrutide could definitely be the next big game changer, at least from what I've seen from the data. There's a lot of hype around one bimagrumab, which they're saying can help build muscle mass and lose weight at the same time. I'm pretty skeptical. Plus, that drug, you'd have to go for like an IV infusion. There'd be a whole thing with it. I don't really see it taking, but eventually, maybe generation 2, 3, or 4 might see it as an injectable formulation that is quite effective and that sort of thing. So I think retatrutide is kind of the one that I'm curious to see more about and see what the data shows. I'm also looking forward to some of the other unique mechanisms of actions and different ways that the technology is evolving. There's a class coming out that like act on the cannabinoid receptors. I'm not super psyched on those. I'm doubtful that they're really going to do a whole bunch. And yeah, I know they've been kind of working on something like that for a long time, but the data, the mechanism, it just doesn't really all stack up. And oftentimes they get caught up because they're also affecting kind of the emotional regulation pathways and definitely leading to things like their mental health concerns. So yeah, that's kind of my thoughts there. Good question. I'm on Mounjaro for type 2 diabetes, and for the nausea, I've learned to not eat so many carbs and eat more protein and fresh vegetables. Sweet. Yeah, that's some great advice. Definitely can help and be beneficial in that respect of things. Absolutely. Barbara, hello, Dr. Dan, fellow Canadian, rock on. I follow you religiously. I've been on 0.5 of Ozempic for 8 months and have lost 67 pounds total. How will I know when it's time to increase the dose? I mean, congratulations on the weight loss to start. Knowing when to increase the dose is really, there's no right and wrong right or wrong answer to it. It's kind of when it feels right to you. So if you feel like you're not getting any more effect at 0.5, you could try going up on the dose. If food noise and that sort of thing is becoming more bothersome, could try going up on the dose. It's just being mindful that as you're going up, we want to be still looking at all the pillars of just getting enough nutrients, getting enough protein, all of that wonderful stuff, versus just cranking up the dose of medication and just shutting down your drive to eat further, just because it's going to make maintaining your weight in the future much, much more challenging. So if a dose is helping you to get to where you want to be, not only with weight, but more importantly with just life and lifestyle, and you're building some really great habits, sweet, then you've got your right dose. And you can adjust and tweak as you need to. So it really varies person to person. Joseph, hello from Toronto. Hello. Do you think I should put the 2 Contrave drugs in a timed release capsule? Is the naloxone or naltrexone okay to break? So if you're getting 2 separate ingredients, the bupropion SR formulation or even the bupropion XL formulation, so XL just lasts a bit longer, it has more of a 24-hour half-life, whereas the SR, I think it's like 18 hours, so we dose it twice a day. That one you don't need to put in a sustained release capsule because it's already there. You could put the naltrexone again into a sustained release formulation or capsule, and then yeah, that could help with just a greater coverage of cravings and managing it. How much benefit it'll be, tough to say, but yeah, you could kind of give that a try for sure. All right. So someone asking about Mounjaro, can I take this medication without a gallbladder? Yeah, you certainly can. There would be no concerns or issues. I have plenty of patients who have had their gallbladder removed, and yeah, we will start them on the medication. Not a problem at all. Yeah, good question there. That looks good. So someone was asking about what about protein drinks. I drink 2 Quest 11-ounce protein drinks a day. The label says 1 drink is 30 grams of protein. Sweet. Whether it's protein powder, protein drink that's already mixed up, protein bars, whatever. If it helps you to get some more protein in, there is nothing wrong with it at all. So someone was asking, I wonder if it would be effective to microdose on retatrutide instead of doing 2 milligrams per week, do 1 milligram twice a week. I mean, if Yeah, in the future we could. It's a lot of people are kind of like trying the microdosing and trying to split up their dosing, and they're looking for kind of all these things that are going to make the drug work for them, I guess you could say. And so I think I've made a video on this previously where there's a couple of different phenotypes or people, if you will, where there's some people who are just expecting magic, and through magic and wishes with the medication, that weight is just going to come off and not making any changes. There's some people who are just not patient enough and just kind of working and consistently building on the various habits and getting more protein, getting more activity, and so on and so forth. And they don't wait long enough for the weight to come off before they then rebound and such like that. And then there's some true non-responders out there. And in that case of things, what I would usually recommend versus like splitting the dose would be more finding a different drug. So some people who Ozempic Wegovy hasn't been effective for, Mounjaro's worked like a hot damn, or vice versa kind of thing. So it depends person to person. The only time that I will dose like a partial dose or split the doses over a week or something like that would be people who have significant side effects, or when they do a dose and then day 5 they notice the drug is clearing out or they're starting to get cravings and hungers back, then I might give them a second dose later in the week and split their dose that way, different things like that. So it really kind of depends. And yeah. All right, so I just got a prescription for Zepbound. She said that I need to eat 130 grams per day. That's going to be challenging. I read beets really help with muscle mass. What are your thoughts on beets? Well, they make your poop go red. I mean, that's pretty much what they do. They're a veggie. They can be a source of fiber, and in general, there's nothing wrong with beets. Helping with muscle mass, it would not be what I would be hinging my muscle mass on. I'd be more focusing on lifting the weights and good quality proteins and that sort of thing. If you want to add beets to all that, more power to you. I always love your content. Thank you for making this so clear and concise. My pleasure. I think you should discontinue Ozempic. Your hair on the sides are falling off. Yeah, clearly it's all fallen off at this point. We just accepted it, and it is what it is. At least you can wear less laundry too. Thank you for helping me. I'm a first-time user, and I need to know how to use it, how to inject. Awesome, love it. Dr. Dan is awesome. So much wisdom, support, and kindness. Oh, thank you very much, guys. It is an absolute pleasure. I've been on Ozempic since May, down 40 pounds about 2 to 3 weeks ago. I noticed my body is sore, like achy. I've lost over 100 pounds and never felt this discomfort. I used to work out regularly, but now I haven't been consistent and realized it's the Ozempic or the lack of my exercise and protein intake. I just started increasing protein and exercise. I've considered vlogging it as well. Thank you for confirming my thoughts. Yeah, I mean, if you're working out and that sort of thing, and you're overly sore or taking a long time to heal, can be an indication that you're just simply not getting enough nutrients in the system. Like you're not getting enough protein to repair the tissues and that sort of thing. So super, super important to make sure you're obviously consuming enough and taking in enough that you can repair and keep building the tissue so you can keep chugging along and stuff. We definitely don't want to cut your calories too much either, because we need the carbs, the fats, all the things to keep things running optimally. So that would be something to definitely look at and see how things go for you. All right. What do you think about doctors that raise patients' dose on a predetermined schedule? I lost 60 pounds on Mounjaro 2.5. I've been taking it for 18 months and just got to 7.5. I mean, on a predetermined schedule of just like every 4 weeks, you're cranking up the dose regardless. Not the best way to practice. really, when it comes to these medications, especially the more powerful ones like Wegovy and Mounjaro, what we're finding is that it's more about finding the dose that works for you. So if it's 2.5, sweet. If it's 7.5, awesome. If it's 15, fantastic. It's more important to kind of nail that piece of it down versus just cranking up the dose to the top end of things. Because in some cases, people just might not tolerate it. So yeah, it's not the greatest way to practice. People are just kind of trying to follow the titration schedule without really thinking and taking into account the patient and the things that are going on with them. So not ideal by any means. Will resistance training negate the typical lean muscle loss that happens on weight loss? Also, is there direct evidence of lean muscle loss with Mounjaro or any GLP-1 agonists? So weight training, yes, weight training is one of the best things you can do to prevent the loss of muscle mass. The big thing to keep in mind is that anybody, anywhere who decides that they want to go on a weight loss journey, as soon as you start losing weight, a portion of that is going to be muscle mass. If you're not consuming protein, if you're not training the muscles and continuing to maintain them, yeah, you're going to lose more muscle mass. In terms of evidence, so there's not like the GLP-1s directly cause muscle loss to occur. It's more via the fact of losing weight and them being effective at helping people lose weight is what's causing the muscle loss to occur. And so people who are on these drugs, if they're making sure they're getting their protein, they're lifting weights and that sort of thing, that can help to manage a lot of that muscle loss and generally something we don't see. But you've got to be doing and working on those things to prevent that from happening. But no, there's no direct evidence that the GLP-1s will actually chew away muscle altogether. So, or on their own, if you will. So yeah, good question though. I did 0.25 milligrams every 4 to 5 days before increasing my dose to see if it helped with side effects. Not sure if it helped though. Did 0.25 with side effects? Not sure if it helped though. Yeah, that maybe wouldn't be the most ideal pattern to do it. If anything, that would cause you to get, I mean, it would get you to like a slightly less high dose, but you'd be essentially getting 2 peaks throughout the week before the other peak fully came down. So you might actually be contributing and causing more side effects. Yeah, I would more look at kind of adjusting the dose up or down slowly and just doing it once a week to really know if it's helping and managing things in that way at all. Sweet. Okay. So I'm going to go back to some of these questions. I've lost 12% of my body weight, lowered my triglycerides by 60%, lowered my A1C and my insulin by not eating carbs. That's fantastic, bro. Yeah, I mean, and then you said, I stopped watching when you mentioned calories and calorie deficit. Silly nonsense coming from a doctor. Oh, David Yummus, 6259. So I think you're one of the ones that fall into this group where you tried something after trying many things, and cutting out carbs suddenly allowed you to lose weight. And so you have made the connection that carbs were the reason why you couldn't lose weight. For everyone in the science world, what we know is that you not eating carbs just allowed you to get into a calorie deficit consistently enough. And that's ultimately what led to you losing weight. You lost 12% of your body weight. At that level of body weight loss, yeah, you're going to see considerable improvements in your triglycerides, A1C, and that sort of thing. So it wasn't the carbs directly that gave you all of these magical results. It was that you just achieved a calorie deficit consistently. I hate to say it there, bro, but yeah, that's the science. There's kind of no getting around it. As much as people like to demonize carbs and that sort, carbs aren't the problem. It's just overeating on the calories, that is. So I'm glad you stopped watching, because clearly we would not see eye to eye on some of this. I'm symptomatic in the low 70s and have hit 60. My doctor said it's not clinically relevant until you hit 55. I'm assuming you're talking about blood sugar levels. You're because you guys use deciliters. I can't remember. Some kind of weird. Americans always have to make things more challenging in terms of units. But yeah, that doesn't necessarily sound right in terms of being clinically relevant. I mean, lots of people, when they first wake up in the morning, they could have like a blood sugar of, below 70 slightly, below 4.0. Sometimes I wake up at like 3.7 or such, and I'm not necessarily symptomatic. I'm hungry and ready to eat, but it's just because I've been fasted all night and haven't eaten anything. So it's not necessarily bad, and it depends on if your body's kicking in the counter-regulatory mechanisms to bring your blood sugars back up, and so on and so forth. So, someone had a comment on bimagrumab. So I just learned about this med. I'm thrilled about this. I'm on Zepbound, and despite exercising and eating lots of protein, I noticed muscle mass loss in 2 months in. I'm also aging as well. I know we lose muscle mass as we age, so especially hate losing muscle mass when my age is also contributing to that. I need muscle. I got my fingers crossed that the trials go very well. Yeah, I mean, we'll have to see how it all looks and stuff like that, but yeah, I mean, that's kind of what we need to, you need to keep doing what you're doing, and some muscle loss is going to occur, and that's totally okay. Someone got real upset. So on my video, Ozempic Max Weight Loss, they said, yes, it matters. That's why we're on the medication. Waste of time. So I think you're too focused on the number on the scale and trying to see a huge amount of weight loss. On average, people expect to lose about 32% of their baseline weight. Mounjaro, currently the best medication on the market, leads to an average of about 21%. For some people, could be about up to 25% loss from baseline. Yeah, that can be a lot of weight and everything like that. But going beyond that, it gets increasingly more challenging to lose that significant amount of weight. In fact, bariatric surgery, a Roux-en-Y, can sometimes lead to 32% or 35%, but the medications are not currently there. Retatrutide might be there, but if you have a outlandish and unrealistic goal in terms of weight loss and what you're striving for, yeah, a lot of people are going to get set up to ultimately fail, because when they don't reach their goal and they're hyper focused on the number on the scale, it's going to be, fuck it, this isn't working for me anymore, and I'm just going to go back to what I was doing, and they gain all the weight back. So yeah, when it comes to weight loss, we really need to look at the bigger picture of what actually are we trying to do here, trying to live a healthier lifestyle, do all the good things, and to live your bestest life overall. And wherever your weight falls out at that point is your best weight, right? The other thing you have to keep in mind is that the more weight you lose, the more sacrifices you have to make in order to get that weight. So yeah, you could get to the point where you're so lean that you get on a bodybuilder stage and you're sub 10% body fat. But I can tell you, you're gonna fucking hate your life. I did it. I competed in a bodybuilding show. I hated every minute of it. It was horrible. You're cold, you're tired all the time, you're exhausted, you feel like crap. Yeah, it's not fun. In order to maintain that, I had to measure every gram, every morsel of food that I put into my body. I also had to add salt to my water to make sure that my electrolytes didn't get out of balance and I didn't get huge muscle cramps. Yeah, you have to look always at this trade-off of what you're going for and making sure that you can lose weight, but keeping it in a realistic sense of what your life involves, the genetics that you're dealing with, and so on and so forth. So yeah, sorry you're so angry. I had lap band surgery in 2011, was at my lowest weight in 2013, and by 2017, I'd gained every pound back. I yo-yoed up and down 30 pounds, and in April this year started Zepbound, and I'm now down 40 pounds. I don't regret the surgery because it helped me learn what I needed to be successful on Zepbound, but if that had been an option back then, this likely would have gone. Fair enough. Yeah, it's certainly something that would A lot of people I think would take, and sometimes talking to patients, they ask me surgery or medications. If it was me, I would, yeah, I would much rather take the medications versus the surgery and such. So, hey, I joined a gym and wear my 10-year-old gym clothes. Awesome. I'm down 20 pounds and will buy new when I lose 30 pounds or more. That is awesome. Good for you. Does Ozempic do the same thing as Mounjaro? So pretty much. Mounjaro has the benefit of it also binds to the GIP receptors. GIP has slightly different mechanism of action throughout the body in some of the things that it does. It may be more beneficial in terms of things like fatty liver. So what's happening there is that it helps with what's called fat cell buffering. So the fat, the subcutaneous fat, the fat that's all on the outside that we all want to lose, if there's too much fat coming into the system, and this is all genetically predetermined as well, your fat cells are only going to be able to take up and consolidate so much fat within them. So first, we start with the subcutaneous fat. They get filled up as much as possible. And depending on the level of fat cell buffering you have going on, whatever then spills over is then going to go and get piled around your organs, which is really the dangerous fat because it's sitting so close to the liver, the heart, and all that kind of stuff that it causes and wreaks all kinds of damage. GIP seems to help with this fat cell buffering and allow your subcutaneous fat to take up more fat and maybe even pull some of the fat that is around our organs out of the liver and that sort so that it goes to the subcutaneous tissues. So slightly different, but yeah, Mounjaro is kind of really the next step that's showing some really cool results. Let's see what other questions you guys got going on. Where are you from? I am currently living in Calgary, Alberta, Canada. I've heard Merck's messages on this. Do GLP-1s boost metabolism, i.e. energy expenditure? Good question. In general, no. People will say that it does increase metabolism because it increases your heart rate, but it only increases your heart rate by maybe 1 or 2 beats kind of thing per minute. Overall, it's not anything that I would hang my hat on and that it's going to help me to lose weight by any means. So yeah, it's not super effective by that measure. What I would say is really what it's doing is it's reducing your drive for food. So it's providing more capacity so that you can think about being more mindful and so on and so forth. So yeah, mixed messages for sure. But if it does increase it, it's a negligible amount that doesn't matter. I'm on Mounjaro. Why does my fasting glucose range from 70 to 90, all within the good range, but still such a wide range? You have normal blood sugars. Like everyone's blood sugars go up and down throughout the day. Blood sugars never just stay completely flat. It's going to be based on what you eat, how fasted you are, whether you worked out and that sort of thing. Your body tightly regulates things, but your body's also not a robot. So it's not just going to keep it flat and keep it perfect. There's going to be ups, there's going to be downs. We'll wake up in the morning, we get a dump of cortisol and various other stress hormones that get us up, get us ready, and we need energy to get up and go out and find food and that sort of thing. So your body produces more sugar, even though you haven't eaten anything all night. Your liver can produce the sugar to help bring sugar in and allow you to have the energy to go out and find breakfast and so on and so forth. So yeah, sugar is going up and down. It's perfectly normal. That's just being human. I just got to maintenance and I do have to be more mindful of the food I eat. I lost 30.4% body weight on Zepbound. One of the best decisions I've made. Congratulations, Jess. That is awesome. I'm on maintenance after losing 70 pounds on Wegovy, moving from obese to a normal BMI. I'm doing Wegovy 1 every 14 days in maintenance. Any advice for increasing muscle mass? Yeah, lift the weights, lift all of the weights, and don't just go and lift the same weights over and over again. Actually go there and push yourself so that you're doing what we call progressive overload. So if today you go and you work out with 10 pounds, next week you want to try and go up to 12.5 pounds, or do 10 pounds for a couple extra reps, or whatever it's going to be. And then protein and sleep. Sleep. Those are going to be the three biggest things that are going to allow for an anabolic environment, or anabolic means building, put you in the best building environment of your body so that you can gain and put on muscle mass. So yeah, and making sure that you're consuming enough food. Good question. All right, I will answer a couple of more, and then I am going to head her. Someone, yeah, first thing you should tell everybody, it's $1,000 a month. Yeah, I said $1,000 a month. You lose weight because you can't afford the meals. Duh. Nobody seems to tell you that it's going to cost $1,000. You know, it's always so funny kind of how people, like the comments and things that come up, and it's just like, okay, like, yeah, it's expensive. Yeah, I'm sorry to say, bud, like, drug development and that sort of thing, the US system in terms of drugs is a little out to lunch for multiple reasons. Hopefully you guys will start working to change that. But yeah, it's unfortunate, and also not necessarily something that's not common knowledge. I don't know. I sometimes don't know what to do with questions like that. All right, I think I'm not caught up, but kind of caught up, and yeah, maybe I'll do this last question. So what's the science behind one of the GLP-1s in trial that lasts a whole month in the body? What about the weekly shots? So, I mean, GLP-1 is GLP-1. All of these drugs have the standard GLP-1 molecule. It's identical to the human GLP-1 hormone that we naturally produce. In humans, our GLP-1 hormone only lasts for a few minutes before it is broken down, but our body produces it when it needs to, and so on and so forth. What they have done with these medications is they basically added like a tail or something else to it so that it lasts longer in the body, and then it takes your body longer to metabolize it and break it down. So we first started with like twice daily injections. So you do one in the morning, one at night. That was kind of effective, not super great. And then we got Saxenda in them that were all once daily injections. So they lasted for a 24-hour period or so. So it got a little bit better. Now we've got to weekly injections, which, yeah, they just have a longer tail, so they're able to last and don't get broken down and degraded as quickly, so they can be around and keep hitting the various receptors that they need to. And then, yeah, going to once monthly, I mean, that would be the ultimate goal. You do a shot and it lasts for that entire month. It's always a question when we do things for longer and longer periods of time. One, if you get side effects to it, then you got to ride out, you know, a month worth of side effects, and that can really suck. So that would be one of the things there. But yeah, if they're getting to once monthly, I mean, a lot of drugs go to that. Sometimes it'll be a depot injection. As an example, insulin was once daily. We now have a once weekly insulin that we dose. And so it's just dependent on the various components and mechanisms and how it's getting released. Sometimes it's a little tail that they add on the end. Usually the monthly ones, they add on something like it's like a depot, so it sits under the skin or in the fat tissues and that sort of thing, and then slowly gets chipped away and broken down. So yeah, I mean, drug technology, I'm by no means, yes, I'm a pharmacist, but not an expert in it. There's much smarter people than I out there, and they would be able to give a much better breakdown, but that's kind of the gist of it, if you will. So excited to catch up. Thank you. How often do you do the live streams? That's a good question. And really the live streams vary. It's kind of more just randomly when I have time and can pop on and chat and that sort of thing. I definitely haven't done one of these for quite a few months now, just because life has been crazy. And then I was in Australia for 3.5 weeks and such. So tons and tons of things have been going on. But yeah, I'm trying to make in more regularity with it for my OG YouTube live members. We do 1 month monthly. And then I do have something that will be dropping here in the very near future. Well, I'll be doing lives a lot more frequently and stuff like that. So stay tuned for that. And yeah, catch me whenever you can. What did Susan say? I'm on Wegovy 10 weeks in and down 13.6 pounds. My blood pressure is lowered significantly. It's a point that my doctor decreased my blood pressure med. Sweet. Congratulations, Susan. Sounds like you're trucking along pretty well. Thanks for answering my questions. My pleasure. Sweet. All right. Lots of great questions, everybody. Yeah, I will try to make this more of a regular thing somehow, some way. But yeah, have a wonderful Thursday, and we will talk to you all later.